Hey, folks, if you want early access to episodes as they drop, click that subscribe button, join us, and together we'll fix the broken U.S. healthcare system. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and I'm delighted to be here today with Karen Van Caulil of the Florida Alliance for Healthcare Value. Welcome to the big show, Karen.
Well, thanks very much for having me.
Of course. How you doing?
I am doing all right.
You're doing all right. You're in New York. You flew in from Florida. You're a Florida organization. You're in New York, but you got some roots in New York. So this is not your first rodeo.
It's not.
Good stuff. And as far as your business is concerned, I would assume from the name that you're focused on organizations in Florida, or do you spread beyond Florida?
Yes and yes.
Okay, do tell.
Yeah, so Florida Alliance for Healthcare Value is Florida's business coalition on health.
Yep.
Been around for 41 years, the organization, not me in my position there.
Yep.
And we have about 83, 84 public and private sector employers in our membership.
Okay.
And some of them just have lives in Florida, but many, if not most of them, have lives outside of
They're
Florida.
multi-state employers.
Multi-state and also global.
Yeah.
So, though market-specific is in Florida, there's a lot that happens, at a national level. And also, there are sister coalitions across the country. We can reach out to them if, we've got a member who's got a critical mass of lives, in a market that they work in.
Yeah. And how long have you been doing this?
So this month is my 14th work anniversary.
Oh, happy anniversary.
Happy anniversary. Time flies when you're having fun.
So you're president and CEO. Did you start the organization or?
No, as I said, it started in 1984.
84.
Yes.
Okay.
Started in the Orlando area and as the Central Florida Healthcare Coalition.
Okay.
And then expanded to include South Florida and changed its name, or at least the DBA, to Florida Healthcare Coalition. And then when I came in, I was getting all kinds of really strange calls about disaster preparedness and response and the medical response. And I'm like, I know this organization does a lot of things, but I really don't think that's it.
Right.
And it turns out that the term healthcare coalition is what the feds use for disaster preparedness and response. And so they were calling me to be able to help. And I was like, that could be a disaster.
Right.
So we changed our name probably 6 or 7 years ago.
You didn't rush out and buy life rafts and stuff like that?
Body bags, stop the bleed, all kinds of stuff, right?
That wasn't in your mandate.
No, it wasn't, even though we do a lot of things. So we changed our name to Florida Alliance for Healthcare Value, short Florida Alliance.
So
works.
tell me a little bit about your journey. Where did you, what were you doing before that? Because this is what we do. We're in kind of the healthcare space in different capacities, to be sure. But as a healthcare consultant, I started in the insurance industry, was kind of dragged into the insurance industry kicking and screaming like, no, I don't want to go. Don't want to do it. Insurance, bad. And it turned out that once I kind of, relaxed and opened up my mind and didn't resist, I was amazed at, the opportunity to, at least for me, both help people and, have a successful career at the same time. And in sales, I really think that that's kind of at least what I want. Like, I don't want to make money on other people's, on the sweat off their backs if what I'm selling them is not truly a value to them.
Sure.
And so when I came to the insurance industry and realized that there was a way to be kind of one of the good guys, at least in my mind, and still be successful, that was kind of, the two pieces of the puzzle that came together that made the career exciting and rewarding for me. And so for you, how did you find your way to such an obscure kind of an organization? Like if you're not in the business and you don't know, you have to find you, I think, right? You're not just...
Yeah, I think all of us who are at coalitions all have a very different way of having gotten there.
Yeah.
So I don't know how far back you want to go, but I started out in academic medical center teaching hospitals. So after I graduated from college, I worked at Duke Medical Center.
Okay.
And so I was a research assistant, and I was a biology major, so that kind of made sense.
Working in a lab and stuff like that?
Yeah, working in a lab.
Okay.
And but I was really interested in health policy. So I got my master's in health policy and administration, and I wound up doing an administrative residency at what is Wake Forest University's teaching hospital, Baptist Hospital. Stayed there after doing my administrative residency in clinical strategic planning. And it was a really interesting department because it was the only one that worked with the medical school and the hospital. Everything was very siloed there. So it was a really good opportunity to see the impact of the faculty who would be brought in and what kind of impact it would have on the hospital in terms of bed occupancy, outpatient services. Did a lot of certificate of need work in North Carolina at the time. Every single thing needed a CON. So that was kind of what I did. We ended up moving to Florida. My husband got transferred, and I said, yeah, that's okay. Let's go to Florida.
Right.
And we thought it would be for a year or two, and it's been 32 years. So
weren't planning on that.
Yeah, I telecommuted, which was interesting for a while, and then I wound up working in the Orlando area.
This is long before COVID. You were doing it way back in the day.
Oh, I had to pretend, that I was in an office, right. A lot of times because I would work from Orlando and me talking to folks in Winston-Salem, North Carolina. So
right.
Anyway, I wound up being hired to write some federal grants to create a system of care for the uninsured in Orange County, where Orlando is. And this is right around 9/11.
Okay.
And we already had like a 25% uninsured rate. So it was really 9/11 really hit the Orlando area very hard because there was concerns that like Disney and Universal would be targets if there was going to be, additional attacks. But if you remember, I don't know how old you are, but if you remember, airline industry, everything kind of shut down. I know, I'm smiling.
Yeah.
Everything shut down
Yeah.
for a while. And so it was really, kind of a really distressing time. And we really needed a system of care for the uninsured. So got the grants, put it together, ran it for a couple of years, and got my doctorate in public affairs, and wound up running the Regional Health Planning Agency. And this is kind of where it starts to, make sense as to where I ended up. In Florida, these regional health planning agencies are in statute in the state law to work with purchasers, providers, and consumers to develop the Regional Health Improvement Plan.
Okay.
Which was to then roll up to the State Health Improvement Plan. So that's when I started to get exposed to the purchaser side in a way that I had really not ever really fully understood.
Sure.
And
that's part of the challenge of our system, right? It's almost like Oz behind the curtain.
Well, I mean, they hide behind the, insurance card.
Yeah.
Employers for such a long time.
Yeah.
And so I worked very closely with the Florida Healthcare Coalition on a lot of initiatives during that time and got to know my predecessor and the members, and we just did a lot together.
Sure.
And I ended up for a short amount of time being at the University of Central Florida College of Medicine as their director of health planning to build the medical city in Orlando. It was one of the first new medical schools in the country in like 20 years.
Wow.
And had this job that was to bring 1,400 primary care physicians from paper charts to electronic health records.
Oh, jeez.
Through that American Recovery and Reinvestment Act. Learned a lot
I'll bet.
in those offices. And boy, they were really holding out. They did not want to come off those charts.
That's crazy. And you're talking post-2001.
2009, 10-ish.
Oh, my God.
When all that money came in, the
Right.
American Recovery and Reinvestment Act, to educate a lot of people on EHRs and all of that.
Yeah.
And really learned a lot on the provider side about the challenges they have. And I mean, that's certainly an area that I appreciate now is not every plan can come at them with a different way to expect care to be delivered, to be paid for, to be measured, to be reported, and it's very overwhelming. So,
Yeah.
so learned a lot. And then my predecessor retired and said, "Yeah, this is where you need to go and work."
Really?
And I was like, "No, I don't want your job." I was like,
That doesn't sound very fun.
I don't know. But, a little bit of time and consideration, and obviously I took the job. And I really,
So wait, were you interfacing with the coalition on the other side?
Well, on a bunch of different sides. So the coalition created the Regional Health Improvement Organization, which was really kind of a big deal. It was before there was any kind of interoperability.
Right.
And so certainly with trying to get these docs on electronic health records so they could plug in, because it wasn't going to be very successful if it was just the two competing hospitals in the market. And so worked with them on that and a lot of other community health improvement projects. They did a lot of good stuff around diabetes and asthma and other areas. So I really, though, I had no benefits, background, really more focused on policy and then, this sort of unique practice in the physician practices. And when I interviewed, so 15-ish years ago, 14 and a half years ago, and they saw that I had the master's in health policy and saw I had the doctorate in public affairs, and they're like, "You're not going to do any policy."
Right.
And I'm like, well, "I'm sorry, what?
Why am I here?
Why am I here?" and I'll paraphrase, but basically they were concerned, didn't want employers who are not in the healthcare business, and our employers are non-healthcare employers. Didn't want to mess up in Tallahassee or D.C. their core business, what they were advocating and lobbying for on health issues. And I remember being in the interview and saying, I think healthcare, and this is 14 and a half years ago, second largest line item is healthcare. I think with some, careful conversation, we could bring that issue to light without jeopardizing education, manufacturing, whatever the industry was.
Yeah.
And we're like, nope. I'm like, okay. And interestingly, it took a few years for them to understand how important the employer voice is.
Yeah.
In Tallahassee and in D.C. because the elected officials think they're hearing from employers when they talk to health plans. And we're like, oh no.
Oh no.
Oh no. And they care about their constituents.
Right.
So they care about their school districts and their counties and the major businesses. They care about working families. So they want that data. They want that information.
Yeah, but, I think...
Okay, what's coming?
So a big part of the issue, hopefully we're going to have Chris Deacon on the program. And she was, if you know her story.
Yes.
Right. So Chris's story. She kind of ran the
New Jersey.
Ran the state of New Jersey health plan. And, she's saying, I'm going to do something about this. And she had a fire in her belly, and she saw what was going on, and jaw dropped, aghast at kind of the nonsense that is healthcare, and had Blue Cross Blue Shield in the meeting. I think it was Blue Cross Blue Shield, if I'm not mistaken.
I think you're right.
And everything was kind of she had her game face on. She was like, "We need to fix this. Need to fix this. Things are moving down in the right direction." And boom. In walks the governor, and
hey, buddy.
all of a sudden, people are high-fiving, and with the insurance carriers, and so, they. I guess my point is, of course, they are concerned about their constituents, but it's a $5 trillion ecosystem, and it is fraught with waste, abuse, and corruption at the highest levels. And to read her story and recognize that she literally resigned because of that. It's a sad state of affairs when we have elected officials that are selling out the American people, and it sounds ugly rolling off the tongue. It's I'm not pleased to share this with our audience, but that's what's going on. It's,
Absolutely. And we've known Chris for a number of years and been very fortunate to have her not only speak at our events, but work with us on important projects. And so I've known about this for a number of years.
And she's amazing. Like you hear her talk and she's dropping bombs.
Yeah. And it doesn't hurt that she's an attorney and she knows what happens in the contracting process and all of that.
Right.
And so absolutely horrified by her story. But I think all the light that she's shining on it now, especially with her book and, her continuing to speak at events, will hopefully change the trajectory somewhat.
Yeah.
We have to keep at it is all I can say. And, there are concerns, whether you're in a community and, I feel so bad for these benefits folks. I mean, they are so understaffed.
Yes.
There's such an enormous amount of work to be done. They're managing millions of dollars of spend. And I would argue to CEO or whatever the leadership title is of that organization that you have a whole army of people over the equivalent amount of money in your core business.
Right.
And you have left this line item to just run amok.
Yeah.
And you've put somebody in there who doesn't have the support they need.
Right. Or often the sophistication.
Right.
Yeah.
If
you're dealing with the biggest line item after payroll in an organization, which is the case for most organizations.
It is second or third, but usually second.
So
it's hard because when we're trying to get the C-suite engaged and they push it right back down.
Yep.
With exceptions. And we definitely have some really activist CEO types. So that's very helpful to have.
So Karen,
that.
how do we fix this? I'm just going to kind of cut to the chase. You've been at this for a while, and I don't mean to cut you off just like that, but people need to know, they need to figure out and understand, so if we have this corruption issue, we have this $5 trillion machine that is healthcare with all of these players that want to keep things just the way they are for all the right reasons, for their fiduciary responsibility to their shareholders, if we call that all the right reasons. How do we turn this thing around?
What an easy question. Well, I think there's market-based solutions, and I do think there's policy.
Yeah.
So I think let me do the policy because that might actually be easier. I don't know. But, I think if we can have more employers speaking up about the adverse impact of certain legislation and situations, fixing PBMs, 340B, transparency, and those types of things, I'm hoping that there are, changes that are made at a federal level that would allow the employers to really see what's going on. And I think the market-based solutions, you can only do that if you can see your data. And this does come back to the battle royale that continues despite the Consolidated Appropriations Act of 2021 saying it's your data, employers, and health plans and PBMs, you need to give it to them. It's still hard. So it's very hard to target initiatives at, to specific providers or in markets when you don't have the price tags and you don't have the receipts.
Yeah.
Or you don't have the data to even tell what's going on.
And even though it is the law of the land, isn't it funny how employers still don't have their data?
It's not hilarious, that's for sure. And we were I'm here in New York, having just come from a conference, and Sean Greminger is the president and CEO of the National Alliance of Healthcare Purchaser
Had the
Coalitions,
pleasure of interviewing Sean, of course.
I know you had a podcast with.
Right.
And we were talking, and I can't remember who he said brought this up, but he said, whoever this person he had bumped into said, it's not that they're not able to get their data. Employers are able to get their data, but they have to really work hard to get it.
Yeah.
And they do have to engage their attorneys, and they do have to really be aggressive and assertive about it, because it is the law.
Yeah.
And eventually, all the arguments of trade secrets and, all the excuses that you hear fall to the wayside because at the end of the day, that is their data and their information.
Yeah.
So I do think that it falls to employers at this point to be change agents.
Yep.
And certainly participating and understanding on
Just
the
do
policy.
me a favor, get a little closer to the
sure.
mic. Yeah.
Understanding, where they can provide data and information to elected officials and have their voice heard. And on the market side, there's lots of good options for them.
Right.
Things that they can do. But as I said, until they can really see where they can make a change that is for the better for their plan members. And it's not always just about cost. That's something, yesterday on this panel, the question was, how do you define value, in oncology care? And I said, I know you all think it's going to be, lower price. It isn't just that.
Yeah.
Quality is very, very important, and so is the patient experience.
Absolutely.
So there's a lot that needs to happen on that end as well. I do think that if we can get employers to be activists, that will make a huge difference. I do think we've got to be able to give as much support as possible, whether those are the good guy broker benefit consultants, maybe independent TPAs, coalitions, to give them the support that they need so that they know what opportunities are out there. There's also strength in numbers. Certainly on the policy side, also on the market side.
Yeah.
We have worked tirelessly for years trying to do bundle payments, steerage, you name it. And the carriers, the health plans, no matter how big the employer is, will say, I'm not going to do a one-off for you. And so when you come to the table with the city and the county and the school district and, a couple of private companies.
There's power in numbers.
And so, a shameless plug to employers out there, if you're not a part of a business coalition on health like the Florida Alliance, take a look at what you've got, in your state, in your region, because it's like-minded folks.
Yeah.
And it's a great learning community, and you can also piggyback on the success of others. And that's something we learned in Florida. So if a public sector employer has been able to go through the whole procurement process and contract with, maybe direct primary care or some, really effective solution, the other public sector can just piggyback on that contract. They don't have to go through that painful procurement process. Yeah. So I think there's hope. I don't think, I don't think we're without it, but
if there was no hope, I wouldn't have a podcast.
Right.
There's definitely hope.
The fact that, employers are not unified, like the PBMs are and the, hospitals in their messaging,
right.
Is the challenge. And I really, someone who asked yesterday at the conference, how come employers don't speak up? We need to hear from them. And I said, I'm starting to see the tables turn, and they are more willing. And I know my board chair, she is with Miami-Dade County Public Schools, and she's really got the superintendent. And that's the third largest school district in the country. So that's a big significant.
They got some bodies.
They do. She said belly buttons is what she said yesterday, right? Lots of belly buttons.
Lots of belly buttons.
And and they're ready. They're ready to talk to the different state delegations and to testify if they need to. They've been able to get their data and see what's going on, and they've also had a lot of pushback, and they've had to fight hard to get what they want.
Yeah, it's such a challenge. I've said it often on the show. The hardest challenge that I've ever faced in sales is displacing an incumbent broker. Yeah. That relationship is really embedded, and if you look at the studies. Marshberry put out a study several years ago, and it basically said that the average tenure for an insurance broker, health insurance broker, was 6 years. And I would argue that seems low to me because people don't change their insurance brokers.
They sure don't.
And because of all the misaligned incentives that are in the system, what insurance brokers have amounted to at the big box houses is the sales force for the insurance carriers. Yes. Who own the PBMs. And so they're all kind of working in lockstep with one another. And I think that's why I interviewed Daryl Moon. I don't know if you're familiar with Daryl. but he was on the show, and he said, the first thing I tell an employer that they have to do is fire their broker. And, that might sound like radical, and Daryl has the balls to say it, but it really is true. If you look at and examine your healthcare spend, and you look at it as a business, whether you're a for-profit or a nonprofit, if you examine the expense as you would any other product or service that you procure,
That's right.
and you start peeling back the layers, and you identify waste, fraud, and abuse, which is most likely what you're going to find, well, then you have a now, with the passage of the CAA, you have a fiduciary obligation to terminate those providers and to put in different folks that are aligned with your corporate mandate as dictated by federal law, and manage the plan assets of healthcare in the best interest of your belly buttons and your members, right? Your members.
Yeah.
And so I don't think we're making enough noise. I don't think the CEOs and the CFOs who are primarily, I guess, who HR reports to, or in the case of large organizations, CHROs, are really kind of heeding the battle cry. I think that they're, and to be fair to them, healthcare is one component
That's
of
right.
their job. It's not everything that they're tasked with. And if they have someone that they trust, then, maybe for the wrong reasons, but just because, they've got so much on their plate, if I was the broker, let's say, and I was a status quo broker, and they know and love me, and I have clients that know and love me and wouldn't fire me for anything, and I tell my clients, you should put this out to market every few years, and if you believe that you could do better for your organization, you are obligated to do so.
Yeah.
And I know that I'm doing right by them. But that should be kind of the thought process, in my view, of any C-suite executive that is operating in the best interest of their people. And listen, with the CAA, and I've had Julie Selesnik and other attorneys on the show, I don't think these people are aware that they could personally be liable.
I really, when you say, what's the tipping point, or what's it going to take? And I thought with the CAA, I was like,
this is it.
This is it.
Yeah.
Certainly on the data piece that we've already talked about, but with that teeth on the fiduciary duty and the attestations and what have you.
Right.
And I have to tell you that most of the benefits folks who are, in work for the employers who are members, they were like, how do you know about this? What is this? I mean, so their brokers, their benefits consultants weren't telling them. And I said, you should fire them because you have a fiduciary duty. You are collecting premiums from your plan members, and you need to attest to the fact that you're good stewards of that money. Are you getting a fair price? You don't know because
Right.
you don't have your data. And you live in Florida, which is the #1 most expensive state for employers purchasing hospital services. So already the answer is no.
Right. Karen, explain to me how any employer that has a health plan out there with one of the big 3 PBMs are spending their plan dollars wisely and in the best interest of their members. That's a huge conundrum. That's a big, big, big problem.
So going back to Chris Deacon and, a lot of things that she helped us with that we continue to kind of try to drive home is, rather than say, okay, fire everybody,
Right.
say, these are the questions you need to ask your broker benefits consultant, and these are the answers you need to have back.
Right.
This is what needs to be in your contract. This is what should not be in your contract.
Right.
And you tell them, hey, fiduciary duty, CAA, it needs to be in here. So she had, created scripts basically
Sure.
for the back and forth that was inevitably going to happen.
Yeah.
Because all the excuses that come back. So not only Chris, but some of the other good folks who we have worked with have been able to, certainly Florida Alliance, but also National Alliance and its members have been able to push out to the coalitions, kind of that start on the push to say, ask these questions. You are the fiduciary. You are entitled to this response, this data, and this situation. And if not, you've got to change what you're doing because you're going to get in trouble.
Right.
And there are very real, lawsuits out there too, and pointing to them. So,
and from what I hear, we're not even getting warmed up yet.
No,
they're
we're
coming.
not. I wanted, we were talking about, the benefits staff,
Yeah.
and how overwhelmed they are. And, you mentioned about HR. Some of our folks report up to the CFO. Some report up through HR.
Yep.
And it's really hard for the folks who report up through finance to talk about more than finance. There's a lot of pressure on them. But the folks who report up through HR, really, a lot of them, they're flying blind.
Yeah.
Because, and one thing that I was doing when we were putting a course together called Value-Based Purchasing of Healthcare at University of Central Florida with the Greater Philadelphia Coalition and with Healthcare Tennessee. And the reason we put it together was because all of these strategic HR management master's classes, across all of these universities, they don't teach one single class in healthcare. They're like, oh, on Special Topics Day, I think we bring a hospital in. And I was like, are you kidding me? So
Right.
I feel terrible. And they may, they think, hey, I got a master's in strategic, management of HR.
100%.
And even though it isn't their only responsibility, I mean, they've got, if you think about it, they've got payroll and they've got benefits.
Right.
It's a huge, huge part. And I do think that
And my first taste of that was as an AFLAC rep when I was first, introduced into insurance. We solicited a group in Manhattan that had 2,000 lives, name that everyone would be familiar with, 2,000 employees, not belly buttons. Mm-hmm. And how big do you think their HR team was? 2 people. Yeah. They had a 2-person staff for 2,000 employees and probably 3,500 members.
Yeah, it's a lot.
And so,
That's a lot to take care of on any given day.
Right. And so folks, aren't really kind of, again, we're all doing whatever your occupation is, whatever your life is like, how many rugrats you have that you're chasing after. No one's focused on this day to day. But that's all part of the problem, mm-hmm. right? So now, you have, the benefits broker that has the relationship, and that relationship is reporting up to someone else, be it the CFO or someone in senior HR, and you've seen it firsthand. They're ill-equipped often to even know that there's a problem.
Yeah, it's perplexing to me on so many levels, though. Because when I've said, why can't you get more help? They're like, well, we pay a ton of money to this broker benefits consultant and all of this and admin for our account manager with the health plan and all of this, to the PBM and so
that's only the money they know about. That's not the money they don't know about.
That's right. And so that's what they see and say, you're already getting, a lot of support. And I said, well, you really need to explain to them that you're not getting the kind of support you need, and you may need to rethink that.
Yeah.
And I, also, so didn't tell my husband I might mention this. Well, he works for a global company.
Okay.
And he is what's called a cost and value engineer.
Uh-huh.
Okay. And some days he works from home, sometimes he's in the office. But the conversations he has about cost and value are exactly the conversations that need to happen on that healthcare line item. And I have said to him repeatedly, when you're costing out the products, the services.
The black ops for the military.
Right. Yeah,
Karen could tell me, but she'd have to kill me.
Right. Yeah, Van Caulil is such a hard name to look up and figure this out. But anyway, where's healthcare in there? Because you guys are down to the penny of copper, cement, what have you, and holding these contractors' feet to the fire. But I know you're letting that healthcare line item run crazy.
Right.
And it's made him a little bit crazy trying to figure out, well, where is that? Where is that cost? I can't find that cost. Mm-hmm. And it just, as I said, it confuses me is how can all these companies across the United States, whether they're doing Six Sigma, lean, having cost and value, focus heavily on their core business, but just all kind of shrug and say, it's healthcare. Everybody's in the same boat. You
Right.
know, it is what it is. And that doesn't even touch on the influence of this broken healthcare system. This is just inside these companies. And so it's going to take getting louder and the benefits folks and, really saying we can't keep this up. And they can't. Because right now, look at these increases that they're trying to, figure out where's the money going to come from. And my public sector folks have nowhere for that money to come from.
Yeah.
So I do think we've reached a point, and if all that's being talked about in D.C. and also for us in Tallahassee, it is going to get even worse.
We're in a bubble.
I think we're going to hear some screaming as things, kind of, get even harder. But, we have employers who are doing a lot of, managing well what they have.
Yeah.
And, that doesn't mean that it's not going to be harder in the coming years. But at least some of them have been able to keep things flat or below national.
So Marshall Allen, God rest his soul, we lost a real champion, investigative journalist, wrote several books, I think, but never paid the first bill.
Yep, I have it on my bookshelf.
Probably the most famous one.
Yep.
He was the first guy that I heard on the circuits that are the healthcare focused, value-based focused broker circuits, to say that we're in a bubble. We're in a healthcare bubble. And it was probably 4 or 5 years ago at this point. And so something somewhere has got to give. It can't, we can't keep, this can't sustain.
That's what I said. I thought we were
longer.
at the tipping point with the CAA, but now I think with Medicaid issues and what have you, I do think it's going to push, because when you have conversations with hospitals and other providers, they say, hey, we love you guys so much, but we're going to have to cost shift to you. Well, you already do. Well, even more.
Right.
Because we're going to lose money on Medicaid, more people will be uninsured, and you guys got to pay, pay for that. And I have that's a whole other podcast for another day on when healthcare systems cry poverty when we know that they have plenty of money. So,
and a big part of that is the fact that, just on the pharmacy side alone, there are 3 lobbyists for every congressperson.
Yes.
And so I think, I literally laugh when I'm watching like Squawk Box or Financial Network and the news, and I see a politician talking about, just making sure that the ACA keeps on and this and that and the other thing. Because I want to believe that they're well-intentioned, but they're just so ill-informed. Yeah. And they're it's not their fault. They're ill-informed because every other person that walks through their office is working for the coalition. And the cartel, I'm sorry, not the coalition. The cartel. And so they're being poisoned.
It's right. It's over and over and over again with that messaging. But when you get in there and say, I know you've heard from the hospitals. I know you've heard from the PBMs. I know, listen to us. This is what's happening to working families.
Yep.
They really do listen, but they do need to see data. They do need to hear directly from the employers.
Right.
I think I don't think that employers can keep quiet much longer.
Yeah.
I don't know how you can feel like you're executing your fiduciary duty and not act. But it's tough to break through. But there are hospitals who want to work with employers. There is direct primary care. There are solutions out there.
So talk to me. I want you to talk to me about the Rosen Hotel, because I know that they're part of. Yeah. They are one of your members, and it's a story that. I mean, if you're in our circles, Rosen Hotels. If you're not, you don't.
Right.
And where I'm going with this is, and you correct me if I'm wrong, but it started at the top. It started with the CEO. Who basically looked at this as an expense, and he was not born here in America. He was, if I'm not mistaken, he was born
was born in New York.
New York? Are you
Yes.
kidding?
No.
But okay, so then he's first generation.
Yeah.
Because I think that was part of the story. Like he didn't have like a typical, I hate to break it to you Americans, but like a spendthrift like
no,
attitude.
not at all.
He looked
He grew up in poverty.
He grew up in poverty and he looked at this and it just turned his stomach because he knew that there was a better way.
Absolutely.
If you'd share that story, it'd be great.
Sure. So you're talking about Harris Rosen, God rest his soul. We lost him not quite a year ago, in November of last year.
New Yorker, I did not know that.
Oh, yes.
All right.
Oh, yes. And so Mr. Rosen wound up, working in the hotel industry, and he came down to Orlando, and he told his story so many times, but he worked for the Mouse for a good long time, and he would joke and say, that his ears weren't big enough, so he couldn't stay there. So he bought like a quality and some small motel in Orlando with a little bit of money that he had saved, and started building a number of hotels. And he always really had like the servant heart, in terms of, he always calls them associates, their employees, their associates, and their lives. And these are folks who make a lot of money and work very, very hard. So he's always looking out for his associates. And so after he had sort of a critical mass of associates and things were going well, they were fully insured. This was probably like 35 years ago or so, and the broker came and said there was going to be some huge increase. It was probably 25% or whatever it was. It was huge, and he was like, "Why? Everybody's been healthy. We've been taking care of them and doing this. Oh, it's not you. You're in a pool, a risk pool, and the others didn't do so well." And he's like, "Well, I'm not." I don't want to be in that pool.
That's not my problem.
Give me my own pool, you know?
Right.
And they go, "No, it doesn't work that way." It was like, "Well, I'm just going to do my own thing." And so he literally did his own thing, and he set up a brokerage and did this. The Rosen Medical Center is a fabulous facility, and they have 7 resort properties. It's probably about 5,000 associates. It's a good number now.
Sure.
And everyone who is an associate has to get their health care at the Rosen Medical Center. And it is advanced primary care.
Right.
But they can go on company hours
and so
to get their care.
Just to give the audience perspective, if it's, and I'm going to round up, but just for easy math, if it's 5,000 associates at a national average of approximately 20,000 per year, it's $100 million expense. Except
that it costs them only $6,000 a year.
Ba-dum-bum.
Ba-dum-bum. And the associates, I think it's like $800 a year for their premiums as an individual. I think it's $2,400 for a family, which is also,
for the year.
For the year.
The year.
Not the month.
Not the month.
Not the paycheck.
Not the paycheck.
No.
Episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit Benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit Benefixa.com today. I just ran a quote for a small group in Atlanta, Georgia. They're based in Atlanta. They have like 20 odd employees participating, maybe 30 all in, and their fully insured rates for their Anthem Blue Cross Blue Shield for family premium was like $4,300 per month.
So I don't want anybody to think that folks are getting substandard care.
Yeah.
Okay, so let me tell a little more about the Rosen story because they've created Rosen care that others can pick up.
And I think that's a huge piece.
Yeah.
I'm glad that you're saying that because people are under the impression that if you're slashing expenses from $20,000 a head to $6,000 a head, quality has got to be suffering. What were you going to Dr. Rusty Nail? What are you giving me here?
No, they absolutely are not. So,
and Mr. Rosen would not have stood for that.
no, he would not have, because their hotels, their resorts are top shelf.
Right.
Okay, they're absolutely stunning, gorgeous facilities.
Yeah.
And so he approaches everything, or he approached everything, and certainly his legacy lives on in the same way, including healthcare. So this beautiful Rosen Medical Center, they've got pharmacy in there, they've got PT. The associates can come on work time. They'll get transported. They'll go pick them up at the resort and bring them over for their health care. They only pay, I think it's $700 or $750 out of pocket for a hospitalization. If they go back a second time, it's nothing. So they really are able to keep their wages, which is important, because you think about what he's got. He's got housekeepers and people who take care of the grounds,
Sure,
and all of that. They attract new employees, new associates from across the world, and many of them have a lot of very serious medical situations, whether that's needing transplants or severe heart conditions, HIV, you name it, diabetes. They are coming to them quite ill, and they get better. They give them everything they need. They most meds are zero cost. They've been able to negotiate directly to get specialty meds at a really reasonable price. They have, done all kinds of direct contracts that have made a big difference, cut a hospital out of the network, and really been able to create a situation where not only are their associates getting healthy and maintaining health if they were healthy to start, they also are not getting gouged in their paycheck. They're getting to keep, their wages, which is very important to them. And Mr. Rosen and his team, and I know now Frank Santos, who's the CEO, let them also know that because they've saved so much money, so many millions and millions of dollars over all these years, they can reinvest in their associates and also in the community. And they're very proud of that. So if you talk to a waiter, at one of their fine restaurants, and they'll tell you, they're paying for my college. They're paying for my kids' childcare. I live in this community. All of this community, whether they work at a Rosen Hotel or not, are getting free childcare.
That's amazing.
They're getting a free higher education, vocational or college, in a public institution because of Rosen.
That's amazing.
So it's not only, not gouging the employee, they're getting healthier, and then there's that pride, that civic duty and responsibility. So it's really the example that is, very hard for people to get their mind around and say, how is that even working?
And he didn't take a vow of poverty, Mr. Rosen.
No.
Right?
So he, as I say, he grew up in a, poor part of the city and got his way down to Florida and managed to be a billionaire. So it worked out well in the end, right?
Yeah.
But he cared very, very deeply for everyone.
So
of his
I got to pause there, because I didn't know he was a billionaire with a B. That blows my mind, and I'll tell you why. Because it just tells me that you can be a good guy. You could be one of the good guys or one of the good gals, and you can still do good for your people and for your community. And I say that because in healthcare, there is a wave going across this country where private equity is gobbling up facilities, healthcare systems, private practices, left and right, all in the name. And I'm not going to paint them all with the same brush and say there aren't some good private equity companies out there, to be sure. But by and large, they're focused on the bottom line at the expense and the sacrifice of everything that's good. And here's a story where clearly that is not the case. This guy managed to put all these pieces together, create better outcomes for his people.
Absolutely.
And I'm really curious. Now you give me a homework assignment, because I'm really curious to figure out how he was able to take in people that had chronic issues, whether it's disease or, very, very sick folks, and still manage to thrive. in terms of this expense as opposed to the national average. And the reason that I ponder that, I don't know if you know the answer, but it's at the end of the day, there's an insurance policy that is backing up every organization, including the big insurance carriers, called stop loss, right? So you have to accept a certain amount of risk. And it's a mind blower to me because they must have gotten so good at this that even in those chronic cases that might have cost millions of dollars in the traditional system, they were able to negotiate to a fraction of that. That's my guess.
Yeah, I don't know the exact answer, but they, created this brokerage and, have all that knowledge on how to, mitigate risk and what have you. But I also think that the arrangements that they have, the direct arrangements, and also being able to have things taken care of at the Rosen Medical Center, which is a, fixed cost, essentially.
Yeah.
I think that combination probably is the answer to your question.
Yeah.
They've had 35 years to perfect this. And I have said,
wow.
When an employer does something, because we've been talking about cell and gene therapies, and there's employers say, I'm a little concerned if I start covering this, that we're going to be a magnet for everybody who believes they could benefit from that coverage. And so, you say, well, pre-existing, you'd have to put some guardrails on there because it's true.
Yeah.
And I always wondered how, I've asked this question many times, how could Rosen Hotels and Resorts be such a magnet and still be able to have the kind of low annual, cost per associate. And I remember years ago, being in a room with Mr. Rosen, and he was really, really, worked up that it had gotten to like $2,000 a year. So this is several years ago, and I was like, not a zero on the end, I was like, wait a minute, I was kind of like new in my job.
Yeah.
And you have a baby who is very, very premature and is in NICU an extended period of time. I mean, you're always going to have those cases
outliers.
that really that will skew things.
But he ran healthcare like a business.
He absolutely did.
So Warren Buffett famously said that GM is a healthcare company with an auto unit attached.
That's right.
Because he's someone that's focused on the numbers, and he looked at their P&L, and he was like, "Oh my God,
paying more for healthcare than steel."
Right. Exactly. And so Mr. Rosen must have been cut from the same cloth and looked at the numbers and just said, "Oh no, oh hell no."
I think I got to know him quite well over the years, and he's very, very generous with the Florida Alliance in so many ways. And I think he was driven by, I can do this better.
Yeah.
On every level. I can do this better. And if there was something in the community that was floundering, he'd get in there, fix it, make it better.
Right.
So I created, learning academies and like our equivalent of a Harlem, type of community. I mean, he's just gone in where he's seen that people aren't able to get it together and fix it. Yeah. Whether that's the government, or community leaders.
Government is never the answer.
Right. Well, and so, he really was very frustrated by how few employers would pick up his model and implement it. And I mean, really frustrated, and understandably so. And I was in many a meeting where he would, get really fired up about that. And, I remember saying to him at one point, you have everything. You have the advanced primary care. You also have all the data.
Right.
You also have the ear of other, CEOs, and you are the CEO. So that isn't, the case for everybody. But he talked to, we had CEO roundtables and be able to do it. And a lot of them, they just said, oh, we can't do it that way because we've got unions, or we can't do it that way because, our folks are dispersed in a larger area.
There's always a we can't.
Yeah. And
that won't work for us.
I mean, there are companies now, because they set up Rosen Care, and there are companies who are taking aspects of it.
Right.
Not every place can have, a one-stop shop Rosen Medical Center that everybody can get to, because he does have folks pretty much in a relatively contained area over by the attractions.
Right. No, and I know that there are employers that took up that torch and picked up that baton and ran with it. And I know that he's retired now, but I'm sure you're familiar with Ray Bowman.
Yeah. Marine Max is also a member, and he was with Marine Max.
Right. And so I met him at a conference, and, we hit it off, and amazing guy. And he was an HR leader who
He's a clinical psychologist.
A clinical psychologist.
His neighbor is like the CEO of Marine Max and said, I need you to be my my person on healthcare.
But a brilliant guy who said, we can do this. And, he followed that model. And I know there are many others in your state that are following
and they
suit.
really, Marine Max, Ray was on my board. It was just we really miss him, I have to tell you. He really, real thought leader.
Yeah.
Also. And the things that he did in oncology were really tremendous. And he just has so much curiosity. And, the Emperor of All Maladies is this big book on cancer. Right? And he was like, you need to get this book and read this so you can understand. Right. And I did. Right. And, to really understand. And he was doing really, really, interesting things in cancer. He's like, I might even think about, getting those dogs who can like sniff out, cancer and, run them around in the, manufacturing facility. So, he was really always thinking outside of the box. It was funny, like right after he said, get this book, I ordered it on Amazon, and I was like, it's so thick. And I read all the time, but I was like, oh my gosh.
Yeah.
And then my son was graduating from University of Southern California, and the keynote speaker was the author of the book. And all the kids were like groaning, because the year before Will Ferrell was the keynote, you know? And they were like, oh yeah. And they're like, okay, this guy? And I was like, oh wow.
Oh, wow. That's great. Ray Bauman.
I'm like the only person here, right?
Yeah, that's funny.
So yeah, we do. I'm really lucky that we do have employers who have been proactive, have been daring, have been willing to, annoy people and do things that, people grumble about, because at the end of the day, they care about their workforce. They care. Mr. Rosen cared very deeply for his associates. Ray cared very deeply for their associates as well. And you do see that, but we need more.
Was it Bauman or Bowman?
Bowman, B-O-W-M-A-N.
Bowman. There we go. I always screw that up. Sorry, Ray.
That's okay.
I love you, man. So when we look at this problem, I think if we really boil it down, and I'm a bottom line guy, it boils down to two things. Either the decision makers are either being seduced by their brokers with misinformation, or they're just turning a blind eye to it. I think those are the only two options. I don't see a third option. I think those are the two options. And you would hate to think, if we're talking about employers with hundreds or thousands of employees where their cost is in the tens of millions, that tickets to the Masters or, going to the West Coast to play Pebble are the types of things that are causing this. And I want to ask you, and I know I'm putting you in a difficult position, but do you see another option? Why wouldn't you look at this like you do any other expense? And why aren't more of them jumping on the bandwagon?
I think they're sold a bill of goods by their, quote, trusted advisors.
Yeah.
I think they are. I know this to be true.
Yeah.
So I don't know that it's exactly those same. Not turn a blind eye as much as being told that this is the best. Don't listen to Karen.
Somewhere in the middle.
Don't listen to Ray. Don't listen to Sean.
Right.
Don't listen to Chris.
It
Don't listen to any of these
great,
people.
but
Don't listen. No, I do feel like they probably have don't listen to Karen. I was like,
yeah.
So I don't think it's turning a blind eye. I think it's, you start paying big figures for these people to be your trusted advisors, and you feel like you need to go with that.
Right.
I think that's it. And I think they're told, this is what we're doing, and the others are all in on it too, who we're working with.
And I think the advisors and the insurance carriers are playing the big F card, the big fear card.
Yeah.
Right? They're playing that card over and over and over again,
Yeah,
if you want to do that, good luck with that.
Yeah, anything innovative,
we wouldn't advise it.
Right. Anything a little different, disruptive, right. They for sure they don't.
Right.
Especially if they are not part of, what would benefit to them. But I really don't believe that it's turn a blind eye or, anything. But I do think this is also the easy button on this other side. If they say, all right, we put the RFP together, and this
look
is what
at the
came.
present. Look at the proposal. Yeah. Look at the colors. Yeah. Oh my! Look at the charts.
That's amazing.
Oh my God.
That they trust them. They trust them. Whether that's years and years of it.
Right.
But we're getting in between that though.
So what has your experience been? Have you seen people come into your organization as members, and have you seen them, like with anything else maybe, just kind of easing their way into the water, not taking, action right away, and just kind of getting to know people? And are you seeing like an adoption? Like now, okay, I've been a member for a few years. We're going to give this a shot.
So, when you've got 80 some, you've seen one, right? In terms of, readiness and everything.
Right.
I really feel like the percentages have changed. I used to say it's like a third. I've got a third who are really proactive. They're doing all kinds of good stuff, right?
Yep.
And like a third watching and like, all right, let's see what the outcomes are going to be of that, and we'll follow. And then this other third that's like, yeah, we're good. I'm like, why are you part of this organization?
Right.
But I don't say that. But like, okay, well, tell me about how you're good. What's good? And it used to be sort of.
Do you ask those questions like you do a round table?
If you're really I talk one-on-one.
Oh, you talk one-on-one.
Yeah, I mean sometimes
that's really good, Karen.
And it is what I said, where it's like we trust and we're told this and this and this.
Yeah.
But we've been pulling on that, to get them into that middle.
Yeah.
Watch this, see this, and exposing them to more. So I think it's maybe only 15% now who are kind of in the, yeah, we're good. And I was like, there's no way you're good, but I got enough others to worry about.
Right.
And I think also the disruptors is maybe a little smaller. I do think we have a lot who are pretty, there's this continuum, right? So you have education, awareness, intent, action, outcomes, right? So we got all these intents, it's like, I intend, I've got an RFP process. I'm lining this up. I'm working on my CFO. I need to see that data. I'll get them to the event if so-and-so is talking. I'll be in that workshop.
Right.
So, I have seen movement. But then I've got folks who show up, they go to one thing and like boom, I'm going to bring them in. We're going to do this. We're going to make that change.
Right.
So we do still have some companies are more nimble than others.
Right. Right.
I guess I don't know what the culture is in that organization for their core business. I should probably ask that and say, if you're able to have that kind of freedom to innovate in the second largest line item, is that just part of the culture of the organization?
Right.
I mean, it's probably not a bad question to ask across the board because it may be consistent. If you've got a plodding kind of company that, has been around forever and we do the same thing and we don't really innovate, maybe healthcare just goes along for the ride.
Oh, but that's such a mind blower.
I don't know. I mean, I'm just asking, just thinking out loud.
So I could tell you in personal experience, I've dealt with companies that are, Fortune 1000 companies, and they're spending $500 million a year on healthcare.
Right. And
I've shown them, bolt-on strategies where the math is validated. Mm-hmm. It's not a question of if this will move the needle. It will absolutely move the needle. And I've shown organizations like this $100 million sustainable year-over-year savings, and it goes nowhere. Yeah. And Karen, excuse my French, but it blows my fucking mind.
I'm sure it does.
Just like, and the question though is, if I'm dealing with executive VP of HR, is that solution being presented up channel? Is the CFO having the benefit of looking at this, or is it just that person's decision to say, nope, you're not the right guy. Not today, Ray. Move along.
No,
Move on down the road.
It would depend on the organization and the reporting relationship. But we have, in addition to having employer members, we have affiliate members, and they tend to be solution providers. and they are, good guy brokers and such. And, some of them think if they join that I'm going to be able to tell a company that they should, take this on. And it doesn't quite work like that.
No.
But, I explain to them about, let's get that information to them. Let's, connect you and everything. And they're almost across the board frustrated too, because they have the receipts. They can say, here's a company, who we've worked with, and this is what we've been able to change. Now, what I'm seeing working better with our members is if they work with somebody who's in our club, if you will, they'll really listen because that's one of their buddies. And so if one member can say, hey, this was a great thing.
Right.
And so we do an event every year called Best of the Best. And so the format for that is to bring in employers who have tackled a tough problem. How did you know you had the problem? How did you pick the solution? How did implementation go? What kind of outcomes, lessons learned? And employers want to hear from other employers.
Yeah.
And so
that's great because it's a safe environment. No one's trying to sell them anything.
Yeah.
You're just really talking about, hey, here's where we were, here's what we did, here are the results.
Yeah, sometimes I have to get that, solution provider not to jump up out of the audience to the mic. And it's like, no, it's not a sales presentation. This is a learning situation because they don't want to feel like it's a sales pitch. They really want to get up and ask these questions. And oftentimes that's when they'll see traction. So I'm kind of like, I guess I could talk all day and it doesn't make a difference.
Right.
But you want to hear from the other employers. So I'm working on getting the employers to speak up on the policy side and speak up on the solution side. You still got companies like, I'm going to tell you what, our solutions are and how it's going. And some are very, very open. I mean, public sector are always really good about sharing. They don't get, weird about that, But some companies are. They're very close to the vest. They'll listen to everybody else. But I'm really working on them too. To say it's your turn to share.
And really, if that's their mindset, they really ought to think about changing that. Because it really is about
sometimes it's the person. I don't know.
I get it. Right? But it really is about everyone pulling together.
Yes.
And ultimately, when you look at what Mr. Rosen did with Rosen Hotels and what they were able to achieve, I mean, look at the quality of life for his people, for his employees, for their families. It's unbelievable, and you don't need to, kind of pay into the system, and it really ultimately is incredibly wasteful behavior. Mm-hmm. But the flip of it is, forget about the money side. What about the person that gets caught in the snares of the system that maybe has a surgery that they shouldn't have had?
Right.
And that's not to say that can't happen in even a controlled healthcare ecosystem. Stuff happens.
Much less likely. But
much less likely. Mm-hmm. But that's huge when you look at outcomes and just the fact that people don't take their medication because they can't afford it, or they try to split medication and think that it's gonna be effective.
Well, it helps the business if you can get people to have right care at the right time, in the right place, at the right price, all of those things, all those rights. And if you can do that, it's going to help your business. It's not just about controlling that line item. They're in their seats or whatever their job is. They're high performing. They're also very loyal to the organization, because if you are exceptional in the healthcare benefit aspect of their compensation, they're going to stay there.
Yeah.
I mean, the turnover at Rosen Hotels is minimal in an industry that has, is famous for huge turnover, because, it really, there's more in the equation than money in, money out. Right?
Sure.
Of that line item.
And that's a huge pursuit for any CEO, as you well know. Like recruiting and retention, it's everything.
Yeah.
And so if you can have your healthcare system be something that is so desirable
that you don't have that churn.
That, people are, afraid to leave.
Yeah.
And listen, we just had a conversation with my daughter who works for a big healthcare system, here in New York City. Yeah. And part of the reason that she's doing what she's doing
is to keep her healthcare.
It's to keep her healthcare. She does like what she does, but it's, it's on everyone's mind.
Yeah.
And even my own daughter is kind of brainwashed to thinking that
There's no other option.
Right. She has to have that
Yeah.
healthcare ID card with that big insurance carrier because that's the best healthcare.
Right.
Is that the best healthcare, Karen?
I don't think it's the best healthcare, right? In fact, I mean, for the folks listening, right, the pre-conversation, right, was in fact that people don't know what their options are as individuals, that there are other options for them. And we have talked to the employers to say, you might think about giving people the cash to go have that baby as opposed to using their card, because the difference in price, it's like a tenth in some instances. It's really, really significant. Years ago, I was working on a project that was maternity based, and we were looking at midwives and such. And I was talking to the midwife, and she explained that, some cases she has to send the person to the hospital for the delivery. Maybe it's a C-section, maybe it's not, but sometimes there's a high risk, and she will turn it over. And she said, yeah, so we have cash price, and it's, $4,000 for a normal delivery and $7,000 for a C-section. I'm like, head whips around, and I was like, where? She names the hospital. I was like, okay, we're looking at 17 and 30,000.
Little difference.
Yeah. And so I wind up going to the hospital folks and working on this larger project. And I said, I always thought that when people were paying cash that it was more, not less.
Uh-huh.
So I just learned this. And she was saying, don't mess it up for me. I was like, okay, I'll try not to. And I said, well, what's the difference between the 4,000 and the 17,000? Oh, well, the ones on the insurance plan, they get a steak dinner.
Oh.
I said, okay, it's been a long time since I had
My math's
child.
a little fuzzy,
okay?
but...
Yeah, but I don't think I wanted to eat steak right after pushing, a kid out of my body.
Did they actually say that?
They did, I swear they said that. And I was just like, this is a joke, right? You're laughing. They were laughing. And I said, what if I tell ex-employer $4,000 and then get a Ruth's Chris gift card and pay for a babysitter maybe 6 weeks out when they really would like to, go out and have a steak dinner.
Now you're thinking
out,
like
right?
a CEO.
Right?
Yeah.
And obviously that was, hysteria, right? And at the hospital that this was going to be this, complete. But I thought all those years ago, and especially having run the system of care for the uninsured, I thought they were paying more. I had no idea. And so that has continued to be something to look at.
Right.
To pay cash. And there's a lot of interest in that because, some
Of
prices
course.
are displayed, some are not in this transparency. But it begs the question of how come 4, how come 17, how come 7, how come, 35, how come?
If my viewers and my listeners have learned anything listening to me, it's that. If you want to be assured that you're paying the highest price, go through a fully insured insurance carrier, and you will be assured that you are paying the most that you possibly can for healthcare. It's just the way the system is set up.
I'm definitely hearing more in, public conversations, social conversations, not work conversations, of people understanding cash price now.
Yeah?
Even if they have decent coverage. They're like, I still think because I haven't reached my out-of-pocket, or I this time of year, I'm just going to pay cash.
Right.
Yeah.
Yeah, and that is the trick. It has to be a cash price. You can't pay cash and put it through insurance.
No, because they'll put it through insurance and you're out your cash.
Correct.
Yes, absolutely.
And so that is not the move.
Yeah.
But yeah, it's
if they've got your card on file, it's going to happen.
So what give me like just an idea of what happens in your organization. Do you host events? Is that virtual and in person? What do I get if I'm let's say I'm a Florida employer and this is something that is on my radar. Maybe I'm not paying full attention, but I hear this podcast and I say, you know what, I ought to look into that. What does the member experience look like?
So we're a research and education 501c3 nonprofit. Okay, just to although we're also a membership organization, so it's a little strange in that end. But on the 501c3 aspect of it, kind of draws on the Mr. Rosen approach of civic duty and responsibility. So though it's not a requirement or a mandate, there is definitely a culture of employers, this rising tide can lift all boats in your community. Your organization will be better off if we can have healthier Floridians, right? And so we do programs like, do you know what the Leapfrog Group is?
Yeah,
with the
of course.
hospital, right? So
Sure.
we're the regional leader for Florida, in that. So they understand that aspect of it. We participate, in state level, policy and such. But on the membership side, yes, we have, big events, conferences. We have a couple a year. We do a lot of in-person workshops on particular topics. High-cost claims is the next one coming up.
No shortage of things to talk about there.
Oh, yeah. This is actually the part 2.
Right.
And, they get the opportunity, bringing in an expert to be able to help them look at their data and see where, areas they can focus. And so there's work that, they can do in a workshop, right, to bring back to the office and try to focus on. We do a lot of virtual stuff because folks are across the state, and it's a lot easier to get on your computer and listen, and we record everything.
But you provide resources.
Absolutely.
You have,
we develop resources. We develop toolkits. One of the things that this week we're presenting, as I said, at this oncology event that you were also at, and we created an employer guide and insights for
Association
oncology
for
management.
Value-Based Cancer Care.
That's right.
AVBC. A lot
That's
of acronyms in insurance, folks.
So we created this employer guide and insights for oncology management. It's a website, so it's always being updated.
And this is important and significant, not only as a humanitarian endeavor, but because cancer is so costly to treat.
It's the top spend item right now. We're seeing folks getting cancer at younger ages, later stage diagnosis. I mean, it's really a very serious area for employers to look at. And it's very overwhelming because there's a lot of points in that cancer patient journey where there could be more value driven.
Sure.
So, as an example, I mean, we create the resources with a bunch of experts with their input, and the fact that it's employer insights in there. Going back to what I said about employers like to hear from other employers.
Yeah.
We're pulling that in to say, here are the case studies. Here's their take on this approach. So,
And that's what I love about your organization is that it's a safe environment.
Yeah.
They're not being sold there, quote unquote, right?
Yeah.
It's really a peer-to-peer for the procurers of healthcare to just get together and share information.
Yeah, and share. And we also do research projects, data related, a lot of benchmarking studies. If they say, hey, Karen, what are folks doing, with cell and gene therapies?
Right.
And, we'll go out and get that information from everybody and share it around. Hey, well, looks like we need to get everybody together and have this conversation. We have meetings with the healthcare systems, with the employers, and a lot of prep for that to make sure that it's, not just anecdotal stories of, patients having navigation problems, that it's like, hey, this is what's going on with facility fees. This is, untenable. What can we do about it? And the hospital knows we're coming in with that ask.
You go into the hospitals and having powwows with the administrative brass there.
Yeah, with the suits, we do. And we do that with the health plans also.
What do you think they say before you show up, just between themselves?
I know what they say. We have moles.
Right.
Anyway.
Bring me your shield.
No, there are a lot of good people in these organizations, and they really want to be able to do the right thing. You got to find the right people to connect with and hope that they can go back internally. And
I think if done right, there's opportunity for them to drive business to their hospitals and to their systems.
Absolutely. And we've had those meetings, and direct contracts have come as a result.
Sure.
And they've just said, look, the only way we're going to do it is if we get the volume.
Yeah.
And it can't just kind of like that one-off conversation. If it's just one, it's not going to work.
Right.
We really need this to be collective. So the hospitals do look at us as a way to convene and get a critical mass.
Yeah.
So Yeah, so there's a lot of things we do. We have a weekly bulletin that we send out that, has a mix of things, opportunities for them to engage, what we've got coming up, but also in case they missed it, if, they didn't know Chris Deacon wrote a book, here
Right.
it is. And don't you remember, Chris, has been, a great partner for us. So
Yeah, she's been a champion for
Yeah,
sure.
yeah.
Is there, I guess, just to kind of wrap, and I don't know, you don't have to name names, but is there like, one member that, just kind of sticks out in your mind? Like, hey, they were in a really, bad way before they joined the organization, and look at what they've done.
I don't want to say they were in a bad way, but I will, like Rosa Nova, who I mentioned, is my board chair, Miami-Dade County Public Schools. And she was on this panel with us yesterday.
Oh,
so
wow. Right.
I will repeat what she said.
Yeah.
Sean Greminger asked her, as a result of, the work, that the Florida Alliance has done, what have you implemented? And she spoke for a good long time.
Really?
And she said, I have learned, what questions to ask, what to expect in answers. I've been able to cut a hospital system out of my network.
Okay.
I've been able to move infusion services out of the hospital to get, them in without facility fees, and saved this many millions of dollars.
Sure.
I've been able to, and she had price tags.
So it
She's
wasn't anecdotal information. It
no,
was real world.
She said, so I mean, she's got like a, I don't know, $400-500 million spend. I mean,
That's a lot. It's a lot of shekels.
Not insignificant. And so, she definitely said, you get out of an organization also what you put into it. So if you're there and you're present and you're learning.
So true. And
she also said, I don't remember whether it was on the panel or when we were in the hall or whatever, she said, whenever, she has to get the dues paid, which is a literal drop in the bucket in comparison to their spend. She said,
I would hope so, Karen.
It is. It's like, it's not a drop of a drop. It is like, you read it in a microscope.
Can you say missed? Budget us.
She said, I reminded the CFO that every single solution provider for the 14 RFPs that she has out there right now, she's in that cone of silence, every single one of them she met through something with the Florida Alliance.
Wow.
So
it's
again,
working for her.
She's very active member, board chair aside. She's there. And so there are others,
Of course.
if we're going to name drop, I feel comfortable, name dropping.
No, but that's important because, and kudos to her, because she's not just kind of going through the motions of her job, to say, oh, look at what I'm doing. She actually found, value and executed.
Yeah.
She's putting, into practice what she's learned. And it's unfortunate, but you can't say that for some people. Just kind of go through the motions. I'll use my son as an example. So when my son was a kid, my wife she was the enforcer. She gave him chores. And so she was like, Raymond, go down and vacuum the basement. So he would come down and he would turn the vacuum on, but he wouldn't be vacuuming. He'd be doing something else. And so there are folks like he's come a long way since then. But yeah, I mean, at the end of the day, you have to, I think, maybe pride is the wrong word, but you have to take stock in your responsibility as an employee. And that's whether you're the CEO or any other member of the organization. Otherwise, what are you doing?
I think people are wired differently. I mean, there are some people who will just let the vacuum run without pushing it, right? I mean, that's, and they've managed to get by.
Yeah.
But fortunately,
I love you, Raymond.
Hope your fiance is checking on your vacuuming skills.
Yeah, no.
But, but I don't think those are the people in my orbit, fortunately.
Yeah.
Because I don't think they would join. We used to have a byline. It was employers who care about healthcare. Maybe I need to pull that back out, dust it off, and bring it back.
Yep.
Because, they do obviously feel very personally about it. And Rosa was saying yesterday, it's not just this spend. She's seeing the impact on their lives.
Yeah.
And she's seeing where the broken healthcare system is also broken for
Yes.
for navigating and getting access. And so, she was even like kind of tearing up over some of the stories that she was sharing. And she said, this is people's lives. I have to remember that every single day.
100%.
Yeah.
And, we didn't even go there, but, some of the other solutions that are out there are Opioid-Free America. You can have, an intervention where
Right.
you have clinical peer-to-peer conversations between doctors that are working on behalf of your organization and the physicians of patients, just saying, hey, is it appropriate that the patient is on oxycodone for this long? And what can we, and the answer is almost always no.
Right.
But that's the type of stuff that doesn't happen in a status quo in a status quo health plan that meaningfully changes the lives of not only the member, but the family members.
Yeah.
Because we can never forget that even though a member might be going through a healthcare event, it's the entire family that's affected. Mm-hmm. And it's the work family too. I always say,
it's true.
It's your even in this day where people are telecommuting, maybe not as much. And I really feel for our kids that are missing an opportunity to interact with, their coworkers in a work environment. I think we're getting back to that. But it really becomes like your second family.
Oh, absolutely.
And so these decisions, it's not just about the bottom line. It's about the health, welfare, and the mental health and the quality of the relationships of everybody that's kind of, in the rings of that relationship. It's crazy. So how do people find you, Karen? Or do you not want them to find you?
How do you find me? Well, let's start with my website. How about that?
Yeah,
right? The
perfect.
organization, it's www.flhealthvalue.org. So
Okay.
FL, Florida, healthvalue.org.
Okay.
There aren't very many Karen Van Caulils out there. There's another option.
Are you on LinkedIn?
Find me on LinkedIn.
Perfect.
Right?
Yeah.
So, yeah. So
Good.
that's Florida Alliance for Healthcare Value. You'll find us.
Awesome. And look, if my advice would be if you are an employer with what I know, particularly in today's environment, you do have an obligation, to your people to be involved and to, learn as much as you can about this issue. And it sounds like you guys are doing a good job informing and educating. It's ultimately up to your members to take action.
That's right.
But I don't see how they
little nudging.
A little nudging, and just being in the room.
Yeah, I don't have the authority to tell them what to do.
Of course not.
But we can continue to encourage them and support them where we can. And and there's misery loves company. So a lot of folks are miserable about healthcare, and they're coming together to try to find solutions, and they can get some kindred spirits, if they.
So I talk about healthcare as a casino because we have this little healthcare ID card, and all anybody cares about is their share of the expense. No one is paying attention to the actual dollars that are being sent. It's very much like a casino. They don't have you, playing with 10s and 20s and 50s and 100s. You got chips. Right. And so it's the same mindset in our healthcare system. And what I tell people is start paying attention to the price. Start asking what the true cost is of things. And if you think about it, no one really pays attention to the whole cost, right? Even in the case of Rosen Hotels, if they got their cost once upon a time down to $2,000, but let's say it's $6,000, $7,000 now per employee per year, and the national average is above 17, that's a lot of money.
Yeah.
And think about that, $17,000 per year, and many organizations are closer to $40,000 per year.
Yes.
That's an awful lot of money.
So it can be done is the message.
Oh, we do it every day. Mm-hmm. The question is, are you going to do it every day? Are you going to get involved? And that's where your organization comes in. So, hey, I want to thank you for being here. Appreciate you taking the time to travel to New York City and spend some time with us. And until next time, folks, love always. Take care.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.